Okay. First, I'd like to thank Dr. Hickey. He couldn't be here today, but he did an excellent presentation. And I'd like to thank Ms. Deb Adams, I don't know where she is, for allowing us to speak. My name is Milandri Harshman. I am a pediatric perfusionist at Texas Children's, and I'm proud to say that I'm a THI grad, along with everyone on our team of perfusionists. Today, we'll be talking about adult congenital heart disease, challenges, and rewards. All right, here's a picture of TCH's Legacy Tower, and a quote that I thought would represent what we believe at Texas Children's. And it reads, "The difference is life-changing. By doing things differently, we deliver the impossible for the benefit of the world." So you might be wondering, okay, what is the difference? And to me, that means having a hospital-wide team that has a culture of trust and support. So we work hard to be the best team, and we provide the best possible care. Okay, so here is a roadmap of my talk today. First, we're going to go over who we are at Texas Children's. We're going to talk about our adult congenital heart program, bypass strategies, and I'll touch on a case that Dr. Hickey talked about, and a case report, and the future of Texas Children's. Okay, so nationally, Texas Children's is #1 in pediatric cardiology and heart surgery. And we currently have the largest adult congenital heart disease center in Texas. So we have a unique team. Our surgical team is trained both in pediatrics and adult congenital heart disease. We use the most advanced equipment and heart technology available. We understand more conditions because we treat more conditions than anyone else in Texas. And we are here for every beat, meaning these children come into us as neonates, and we take care of them through adulthood. And finally, we have a dedicated floor that was added for the adult congenital heart patients. And so here are some statistics. Cool. Well, now you can see, as I said, from 2018 to 2022, these are our adult congenital cases, and they have been steadily going up. As you can see, Legacy Tower opened in 2018, and then in 2020, we opened the 24th floor to serve the adult congenital patient population. And then now you can see my pie chart, 16% of our pump cases last year were adults, and I expect this number only to go up. Okay, next one. Okay, so now we're going to talk about bypass strategy for these adult congenital patients. Next one. So when we operate on these patients, a lot of them are very sick and they're often lost to follow-up. They have very unique anatomy, so cannulation has to accommodate this. And it's definitely a growing population. As you can see, there are more adults living with congenital heart disease than children, which is kind of crazy that we have so many out there that are often lost to follow-up. High risk reentry. A lot of these patients are redo chests, and so they have a lot of comorbidities, and it's very difficult to get into the chest safely. Electrolyte management on pump. We give a lot of cardioplegia because these cases are very long and often a lot of blood products. So you really have to be on top of electrolyte management throughout the case. You need a Z-buff, C-buff, and then when you think you're done, you need a Z-buff some more. And we provide the same level of care for these adults as we do our neonates. Next, we'll talk about the case report. So I actually was the perfusionist that did this case with Dr. Hickey. Like he said, the patient had pulmonary atresia, a VSD, a BT shunt, a tetrad pair in 1975, and then Cooley did a Rastelli on him in 1979. And that conduit, the RVAPA conduit, lasted the patient 12 years and then was replaced in 1991. And this patient lives in rural Texas and was lost to follow-up. And he presented last year to us with pulmonary atresia, aortic root aneurysm, AI, conduit failure, and endocarditis. And then, as you can see, these are the pictures Dr. Hickey showed. We had to go on femorally because the aorta was right there on the sternum. These are the pictures again that he showed. You can see all that nasty endocarditis. This is with the Bentall and the RV to PA conduit already taken out. And then the aortic valve is that top picture. And then you can see the last one is the finished product with the Bentall, the RV to PA conduit, and that patch that had to replace all that like nasty tissue that was infected. So you may be wondering, what happened during the case? Okay, so I was on pump for 5.6 hours. It was really not that long compared to some of our other cases. Clamp time was 3.5 hours. We did circ rest for 5 minutes. We cooled down to 25, and we actually closed after many hours. We did close the chest in the OR, and we were extubated in the OR. The patient was discharged post-op day 14. Okay, so you're wondering what is in the secret sauce? So you have to have a pre-flight game plan. And by this, I mean, everyone that will take care of this patient, they have to meet the day before, not when the patient rolls in, not when you come in the morning. You have to meet before the patient rolls in the OR, preferably the day before. Everyone has to sit down and talk about this case so that we're all on the same page. You have to have a physiological prime. So, and you might be wondering, oh, it's an adult, you know, like your prime volume is greater, the patient's blood volume is greater, but that doesn't matter. You have to have a low lactate. Your electrolytes have to match the patient. Just with the neonates and adults, you don't want to see any change once you go on bypass. So your prime has to be physiological. Even if you're only doing an albumin cleared prime, you have to match the patient. You have to have effective communication. There should never be any doubts as to what you are saying to the anesthesiologist, what you're saying to the surgeon, what the surgeon is saying to someone. Everyone has to be completely on the same page. There should never be doubts as to what I'm saying, what the surgeon is saying. Effective communication. You have to pay attention to your patient. And this means meticulous attention. You keep the maps 70 to 75. This patient had a higher pre-op baseline map, so we kept the patient's map 70 to 75. Literally 70 to 75. The NIRS, we run NIRS on all patients. You have to keep an eye on your baseline and where you have gone on bypass. You don't ever want to be below baseline. Aortic blood gases, arterial blood gases, we run blood gases every 20 minutes on pump. So we're lucky in the sense that we have a gem right on our pump and we can run our blood gases, but you have to manage your patient appropriately every 20 minutes. Like I said, continuous Z-buff with our washing solutions. This takes a lot of by the end of the case, you've got canisters lined up at the back wall, like 15 of them. But that's just what it takes because this patient is larger and your volumes are larger. Every detail always matters. Everything matters or nothing matters. So we look at it like that. You might think, oh, it's an adult, but that's not the case. You have to have the same level of detail for an adult as you do a baby. Adult congenital disease patients, but you have the same perfusionist. So oftentimes people think, oh, pediatric perfusionists they're a little crazy, but you have to be crazy in a good sense where you're taking care of your patient regardless of how old they are or what their history is or what you're going to be flowing on bypass. And I guess the most important ingredient is you have to have a team effort and a well-oiled machine. The team has to be familiar with one another and they have to continue doing what they do every day in the same effort. So you don't have an off day because it's Friday. You don't have an off day because it's Monday. It's all the same, well-oiled machine every single day. And next, what is in it for the future? And hopefully, okay.
We believe in possibilities at Texas Children's. As the nation's largest women's and pediatric healthcare system, we believe that all lives can be changed for the better. For every cure found, we're dedicated to finding another. For every life changed, we're determined it isn't the last one. By doing things differently, we deliver the impossible for the benefit of the world. Texas Children's. The difference is life-changing.
Thank you.